Hello, everyone. This is Mr. Donati. Today, we are going to finish the disease unit by looking at a couple more non-communicable diseases, some that are that affect a lot of people. The first one we're going to investigate and learn about is diabetes. Diabetes is a disease in which the body's ability to use glucose, blood sugar, is impaired. Diabetes involves insulin, a hormone produced by the pancreas. Insulin stimulates body cells to take up and use blood sugar. If not controlled, diabetes can be life threatening. People with diabetes are also at risk for heart disease, stroke, kidney disease, blindness, infections requiring amputation, and complications during pregnancy. There are two common types of diabetes, type 1 and type 2. How does it work? Your body breaks down the food you eat into glucose, simple sugar. Glucose is the body's main source of fuel. The pancreas, sensing that you have eaten, releases insulin. The insulin allows glucose from the blood to enter the cell through the body. Diabetics either do not produce enough natural insulin or cannot properly use their insulin to move the glucose into cells. Instead, the glucose stays in the bloodstream and can cause many health problems. If not treated properly, diabetes can cause kidney problems, blindness, and heart disease. Type 1 diabetes, which accounts for about 5 to 10% of all diabetes cases, appears suddenly and progresses quickly. The body does not produce insulin and glucose builds up in the blood, starving cells of the energy they need. Over time, the high blood level can cause damage to the eyes, kidneys, nerves, and heart. The cause of type 1 diabetes is not clear. Some scientists suspect an environmental trigger, perhaps a yet unidentified virus that stimulates an immune response, destroying the insulin producing cells of the pancreas in some individuals. People with type 1 diabetes must take daily doses of insulin. Type 2 diabetes accounts for about 90 to 95% of all cases of this disease, and it most often appears after age 40. However, type 2 diabetes is now being found at younger ages and even being diagnosed among children and teens. And the result is because of diet choices and lack of exercise, and pretty much anything dealing with lifestyle choices. People with type 2 diabetes produce sufficient insulin, but their body cells do not respond normally to insulin. In this form of diabetes, the body is unable to make enough insulin or to use insulin properly. This type of diabetes is usually related to lifestyle choices such as diet and lack of exercise. Usually, with people with this type of diabetes, if they make a slight change, usually that can help get a person down below diabetic levels. The next disease we're going to look at is arthritis. Arthritis is a disease of the joints marked by painful swelling and stiffness. This disease is usually linked to older adults, but even children can get arthritis. The two most common types of arthritis are osteoarthritis and rheumatoid arthritis. Arthritis is a group of more than 100 different diseases that cause pain and loss of movement in joints and is one of the most common medical problems in the world and the number one cause of disability in the United States. More than 1 in 6 people suffer from this disease. Osteoarthritis is the result of cartilage breaking down. If you look at or understand how a pencil works with an eraser at the end, over a period of time, basically your cartilage in your joints will wear out just like you would, like a pencil would, as you erase any kind of mistakes on a paper. Over a period of time, the cartilage is going to disappear and it will become pitted and frayed. At this time, it may wear away completely and bones may rub against each other, causing immense pain. Although osteoarthritis affects primarily weight bearing joints of the knees and hips, it can affect any joints, including those in the fingers, lower back, and feet, causing aches and soreness, especially when moving. Osteoarthritis is the most common type of arthritis. Over time, the joint, like your hip, must be replaced in order to help the pain associated with this type of arthritis. Rheumatoid arthritis is a disease characterized by the debilitating destruction of the joints due to inflammation. Like type 1 diabetes, this type of arthritis is caused by an autoimmune disease for which there is no cure. Eventually, the joints may become deformed and cease to function normally. Rheumatoid arthritis affects mainly the joints in the hand, foot, elbow, shoulder, neck, knee, hip, and ankle. About 70% of people who with rheumatoid arthritis are female. Allergies. An allergy is a specific reaction to the immune system to a foreign and frequently harmless substance. Pollens, foods, dust, mold spores, chemicals, insect venom, and medicines are all some of the more common allergens, substances that causes allergies. Antigens on the surface of the allergens bind to special immune cells in the lining of the nasal passages. These cells release histamines, chemicals that can stimulate mucus and fluid production in the area. When someone comes in contact with an allergen, their body's immune system believes the substance is harmful to the body. In order to protect the body, the immune system produces chemicals called histamines and releases them into the bloodstream. Histamines are chemicals in the body that cause symptoms of allergic reaction. When avoidance is not possible, medicines, including antihistamines that help control the symptoms triggered by histamines, may be suggested. Asthma. Some of the allergic reactions can lead to asthma, an inflammatory condition in which the small airways of the lungs become narrowed, causing difficulty in breathing. The bronchial tubes of the people with asthma are sensitive to certain substances called triggers. Common asthma triggers include air pollution, pet dander, and tobacco smoke, as well as microscopic mold, pollen, and dust mites. A bronchodilator, also known as an inhaler, is a type of medicine that relaxes and widens the respiratory passages. On a final note, you have heard me say this many times, but you need to adopt healthy behaviors such as regular physical activity, maintaining a balanced diet, avoiding tobacco, alcohol, and drugs. This will help encourage you to make healthier choices in everyday life. With that being said, thank you for watching the show, and I hope you enjoyed it.